Hi, everyone. Welcome back to the third and final part of our gram-negative bacilli lecture as part of our medical microbiology for medical students series. In the first part, we talked about enterobacteriales. In the second part, we talked about non-fermenters like Pseudomonas. And in this third part, we're going to talk about other smaller groups of organisms. Hopefully, it'll be a little bit easier for us to kind of keep them in our heads. The first group we're going to talk about is fastidious organisms. So Haemophilus is kind of the poster child for fastidious organisms, with Haemophilus influenzae being the most important one medically. These ones, look like gram-negative bacilli. They have a tendency to be a little bit smaller than your average E. coli, but on the clinical side, that really doesn't have any sort of impact. Haemophilus is not our friend. Haemophilus, unfortunately, is part of our normal flora. Similar to lots of other potential pathogens, it lives in our nose, in our sinuses, in our throats, but it does have virulence and it has a tendency to get to places where it doesn't belong. So the most common places that it goes are definitely in the upper and lower respiratory tract. So it causes ear infections, it causes pneumonia, it can cause basically any infection that's connected to the respiratory tract, like COPD exacerbations, sinusitis. But that's not the only thing that it does. There's also this H. influenzae type B, sometimes called HIV, which is actually a hypervirulent type of Haemophilus influenzae that does not just cause these sorts of respiratory tract infections, but actually goes outside and causes tissue invasive disease quite commonly. For example, here's a historical picture of a young child with meningitis. Here is a radiograph of a patient who, it's hard to see in this image, but has epiglottitis, which is where you have invasion into the epiglottis, and it actually causes so much inflammation that it cuts off your airway and you choke to death. So these are really like truly horrific forms of disease that mainly affected young children. And for a very long time, it was one of the top causes of child death, even in places like Canada and the United States. Luckily, we now have a vaccine for HIV that we give routinely in childhood. So I've actually never seen a case of HIV. They're very uncommon in our vaccinated population. But this is an example of why keeping up with vaccines is so important, is because, run-of-the-mill Haemophilus is nasty enough on its own. If we stop vaccinating and things like HIV come back, like people are going to die. So that's Haemophilus, not our friend. Next, we have HASEC. So HASEC is this big mnemonic, which stands for Haemophilus, Aggregatibacteriophrophilus, Cardiobacterium hominis, Eichmann corridans, and Kingella kingae. These are all very annoying names to memorize, unfortunately. None of them roll off the tongue very well, except maybe Kingella kingae. That one's a bit fun. But I think they're all similar enough that you can just remember HASEC in your mind. When we talk about things like Haemophilus species that aren't influenzae, Aggregatibacter, these are organisms that are somewhat pathogenic, but are also part of the flora and might not truly be pathogens if they grow in your patient's culture. They tend to live in warm and moist environments, again, like the nose and the throat. And that's where they tend to stay. But in some unlucky patients, they do, for whatever reason, cause invasive disease. Like we see infective endocarditis with all of these HASEC organisms. Because they're not very virulent, it sometimes takes years, probably not years, months up to a year for them to be overtly ill. But you do see life-threatening disease from HASEC organisms. Some of them can also cause other sorts of disease. Here is a picture of osteomyelitis, which Kingella kingae is particularly prone to cause, especially in very young children, for reasons that are a little bit obscure to me. But these pictures are really just examples of how there's all these random bacteria like these HASEC organisms that you're not going to run into very often. But when you do run into them, you really have to put your thinking cap on and think, does this match up with my patient's clinical situation? If you've got a patient who's otherwise healthy, has a clear reason to be in the hospital, and their blood culture grows one set with Aggregatibacteriophrophilus, I don't know if I necessarily care about that. But if you have a patient who's having fevers, who's having signs of endocarditis and you've got multiple cultures with the Aggregatibacter, that's when it's like, this patient might actually have a life-threatening infection with this Hastek bacteria. Next, we'll talk about Pasteurella and Capnocytophaga. These are, again, not very common. Pasteurella has multiple species, but the few that we care about are Pasteurella multocida and Pasteurella canis. Capnocytophaga also has many different species, with Capnocytophaga canamorsus being the most common. Again, these are not names that roll off the tongue and are hard to get to stick in your brain. If you need a little mnemonic, it's cats and dogs, because things like Pasteurella canis and Capnocytophaga canamorsus live in the mouths of dogs and cats. And so if you get bit by a dog or cat, or one of them comes and licks your wound, then you can get quite nasty infections. Pasteurella is definitely a major pathogen in animal bites. And Capnocytophaga is not as common, but when patients get it, they have a tendency to be quite sick. And in immunocompromised patients, they can actually die, in less than 24 hours just because of how pathogenic this organism can be. Again, the most common presentation is definitely skin and soft tissue infections, but this just emphasizes the importance of taking a good history from your patient, because if you don't get that history that their wound is because their cat gave them a bite, then you might never consider these organisms. So that's all the fastidious ones. The names are really difficult, but once you have the names, I think it's a relatively short list for you to keep in mind. Next, we'll talk about some of the curved gram-negative bacilli. So these are organisms that are not just straight bacilli, but have kind of curvy rods like this. Not that you're going to be looking at gram stains. Vibrio is probably the most famous of these, with Vibrio cholerae being number one famousness, and then Vibrio parahemolyticus probably being the most common after that. Vibrio cholerae causes cholera, so this is not normal. If you find it, you should definitely be calling infectious disease for help. And Vibrio parahemolyticus is not quite as aggressive as cholera, but does cause life-threatening disease if you find it. So again, is a pretty nasty bug. Cholera, I don't have time to tell you everything about cholera, but it is very real. It is not some historical pathogen. There are many places in the world having ongoing cholera epidemics where patients are dying. This is a picture from a cholera ward where, there's not a whole lot you can do for patients with cholera, especially if you're in a low resource environment where you can barely maintain a healthcare system to begin with. So what they often will do is put patients on cots and then cut a hole in the cot and then put a bucket underneath the cot and just try and replace as much fluid going into their mouth that is coming out of them and into the bucket underneath them. So cholera, again, not very common in Canada, but you do need to be aware of it as a medical student. Vibrio parahemolyticus is kind of a cute organism in the sense that the epidemiology of it is a little bit fun, even though it does cause life-threatening disease. This is one of those organisms where taking a history can be interesting because you're asking unusual questions like, have you been eating oysters? Or have you been having other weird saltwater marine types of exposures? Because this is not part of the normal flora. This is something that you tend to find in saltwater environments or things that come out of them. So a typical case, for example, would be a patient who is a bit immunocompromised at baseline. For example, they have cirrhosis, and they went against their doctor's advice and ate some raw oysters. And then a couple days later, they are in the ICU with sepsis and these horrific skin lesions. So Vibrio parahemolyticus is kind of like a textbook example of these weird Vibrio species that, again, if you don't get that history, if you don't get the epidemiology, you might miss the diagnosis in your patient. Other than Vibrio, probably the most famous other genus of curved gram-negative is Campylobacter. Campylobacter jejuni and Campylobacter coli cause very similar types of disease, and again, they are not friendly parts of our normal flora. To oversimplify things, these are diarrhea-causing organisms. They cause gastrointestinal infections similar to Salmonella, Shigella. So especially in Canada, if you're thinking about diseases like Salmonella, Shigella, hemorrhagic E. coli, Campylobacter should also be on your list. Quick little bonus. So Vibrio has a bunch of water-loving friends like Aeromonas and Plesiomonas. They don't actually fit in the curved GNB category. They tend to be a bit more straight, but they cause similar sorts of disease as Vibrio. And they are not our friends. They cause diarrheal disease, similar to cholera. And they also cause weird wound infections after water exposures, such as shark bites, alligator bites. So again, I would be very surprised if you in your career are going to encounter a patient who has just had a shark bite. But again, if someone was like out on the water, if they were out of the ocean, they get a scrape or a cut, and then they have a skin infection, these kind of unusual organisms like Aeromonas and Plesiomonas are ones you have to think about. So that's it. There's a lot more atypical gram-negatives, but that's all the typical gram-negative bacilli that I think you need to know at the medical student level. To summarize again, we just have 4 big groups to memorize, which is Enterobacterales, non-fermenters, fastidious organisms, and curved GNB. In each of those, there's a few really high-yield organisms like E. coli and Salmonella and Shigella for Enterobacterales, Pseudomonas for non-fermenters, Haemophilus for fastidious, Vibrio for our curved group. But as you go through your training and get more clinical experience, hopefully you can re-go through these organisms and really stick in your brain what patients with what sorts of risk factors get infections with these different GNB. Final slide here is just some references for the open source pictures I used for this lecture. Thank you again for tuning in, and we'll see you in our next video.